Hi, my name is Linda Straub-Bruce, and I'm the president of the Pennsylvania Dental Hygienists Association. Today on In the Know, we're going to do a little bit of Mythbusters with some dates that are floating around out there today. It is April 1st, and today Governor Wolf issued a stay-at-home order for all of Pennsylvania's 67 counties. So the entire state is on a stay-at-home order that expires at this point on April 30th. So a lot of people think that that might mean that we're going to be back to work on April 30th or perhaps May 1st. Just to break down what that April 30th date means is that's for our communities. We're working on COVID-19 mitigation to try to prevent the spread, flatten the curve. You know, you watch the news, you know what that means. That's when our current stay-at-home guidelines are expected to expire. That date could change. That doesn't necessarily mean that's when we are going to be back in our practices and our offices seeing patients again. So there's a few dates that are pertinent in this situation. Where we stand right now is we are still only urgent and emergency dental procedures are to be being done in the state, and that is indefinitely. So there is no date set for that to end. It will end when they tell us it's going to end. So on March 6th, Governor Wolf issued an emergency disaster declaration. So that's going to come into play in a second for something I'm going to go over with you. But so right now we're in a state of emergency, and Pennsylvania is under that disaster declaration. On March 19th, Secretary of Health, Dr. Rachel Levine, and the governor signed some guidelines that only dental emergencies are to be treated. And on March 22nd, the first initial guidelines for dental practitioners during COVID-19 came out. Now, that did throw us into a little bit of chaos because it had a requirement for negative pressure rooms, and basically, logistically, it shut down dental treatment across the state for emergencies even. So those patients were deflected to the emergency rooms, and the ERs are the last thing we want to do right now is flood the ERs with dental emergencies. So when those guidelines came out, dental stakeholders and leaders of professional organizations like myself, we immediately sprung into action communicating with the governor's office and the Department of Health and advocated to have these guidelines revised. So we had a phone conversation with them on Thursday, March 26th, late in the day, and then after our conversation, the revised guidelines were released. So if you want to read the guidelines, you can find them. Members, we've emailed them to you. They're on our Facebook page. They're on our COVID-19 resource section in our webpage. But you can also go to the Department of Health to read the dental guidelines. And I didn't print it in color, but in bright red, it will say March 26, 2020. These are the current guidelines that we're operating under. And we kind of gone over those. You know, I know members got a pretty extensive email. So it breaks down the treatment guidelines for someone known or suspected to be COVID-19 positive and how you treat that patient with your PPE versus how you handle and manage that patient appointment if that patient is not known, not suspected, or proven to be negative for COVID-19. So those guidelines are in effect until further notice. Another date that keeps cropping up is July 1st. So the July 1st date is a little bit different. When the emergency disaster declaration occurred, that caused a lot of agencies to have to go into their disaster plan and protocols. One of those agencies is the Center for Medicare and Medicaid Services. So what they did was they, in response to the disaster declaration, they have restricted medical assistance fee-for-service procedures that are elective or routine, they will not cover those until July 1st or after. So they came out with their bulletin. You can look up on their website, the provider tip number 235, and it says that they will be addressing the urgent and emergency procedures from now until July 1st, and elective or routine procedures will be covered again after July 1st. However, if you continue to read, it does say that if the declaration for disaster is lifted prior to July 1st, they will change that date and reissue a new update. If it persists July 1st or after, they will change the date again and keep us updated. So a lot of these things are, they have to have their dates, their policies, and a plan in place, and then we are adapting as the situation plays out, because it is very fluid. Updates are coming out. At first, it was coming out by the hour, very difficult and exhausting to keep up with. Now it seems to be toning down a little bit. We get different updates maybe by the day, or certain agencies every couple days. So a couple of other dates of note is the Paycheck Protection Act, which is part of the Small Business Association loans through the CARES Act that recently passed. So some of our public health dental hygiene practitioners are small business owners, and this is pertinent to you. This is an 880-page document that you get to try to decipher, but the exciting news was that it was announced today that applications for small businesses and sole proprietors are open on April 3rd. They will begin taking applications for the PPP. Applications for independent contractors and self-employed can start applying on April 10th. That's when your applications are open. There's the EDIL loans and a couple other things that we're not going to get into on this session, but rest assured this Friday, the first round of applications will be accepted. So we're getting there, it's progress. So everybody wants to know when we're going to be back to work, and unfortunately we just don't have a good answer. The authoritative bodies that will help us know when we can go back to work are the governor's office in conjunction with the Department of Health. So we are communicating with them regularly. I have a phone conference with them late this Friday afternoon with the Department of Health. They're in contact with the CDC experts, epidemiologists, and it is just, there's no blueprint for this, so we're all kind of figuring it out as we go and adjusting as we can. So we're going to continue to stay in contact with that Department of Health. That is where you want to get your reliable information and your guidelines for practice, and we will update you as soon as we hear any changes. But know that we're here advocating for you and trying to stay right on top of everything and push out the information as quickly as we can. And I just want to give a shout out to all of those amazing hygienists across Pennsylvania. The things that I have seen go on the last few weeks, I just think I can't get more impressed than I do. Shout out to Bonnie Brown. I'm watching you pull all that PPE that's been stored up from Mom and PA to get it out to the healthcare workers that desperately need it. Shout out to Penn College of Technology. Their faculty miss their students so much. They made this amazing video. You can see it on our Facebook page. Check it out if you haven't seen it yet. You know, they're really coming together and, you know, connecting with their students that they miss very much. The Northeast component, shifting all these live courses to live webinars to give quality continuing education that is reviewed for Pennsylvania standards. Melissa Lucarelli in the Southwest, I call her up and I say, girl, I need you to get me a live webinar platform, and how quick can you have it set? And she was lightning speed to take care of us. All of my colleagues up here in Northwest Pennsylvania that have been so supportive in helping me, you know, find out information, get it pushed out. everything that's going on across the state. I could not be more impressed. We have our PDHPs, our certified school dental hygienists, we have our clinical dental hygienists, our educators, our students, our administrators and business managers, our lecturers, our sales and marketing hygienists. I'm sure I'm missing somebody, and forgive me if I did, our researchers, you name it. There are so many great things going on. So keep in contact, share some exciting news with us. We love seeing what's going on, and be safe and healthy, and we'll keep you updated.